Currently, the medical institution does not reflect accurately the communities that it serves, particularly communities of color. And so I think that is key because there is a rapport there that needs to be strengthened between the medical institution and the communities in order to build better trust and better provision of care.
As an African student and youth in my community, I've always felt like I have limited opportunities and support, and this sometimes has made me think of giving up, since I feel like even if I did the best, I'll still not get an opportunity to reach my goal.
And so what we needed to do, we felt, was to find a process and find community engagement that would support students not only to enter the professions, but to support them through their health education and indeed engage them upon graduation as well.
The project that we're working on is our PLANS co-op placement opportunity. So it's a co-op placement for grades 11 and 12 students to explore all of the various health programs. So they were able to participate in hands-on activities, learn from mentors, and hear from other students that are involved in those programs.
As a physician mentor for the students that are partaking in it, and that means being there to do things as simple as talking to the students and being accessible to them when they need to talk or ask questions. But it also means being available for actual mentorship, in that they could come to my practice, my outpatient practice, or even here at the hospital to do things like shadowing to see what it's like to be a physician at Dartmouth General Hospital.
And through the PLANS co-op program, I got to experience a lot of hands-on activities, which made it really enjoyable, and that's the reason why I wanted to go into respiratory therapy.
I think RBC is among those partners who understand and perhaps share that vision, a vision that the health system should be reflective of the people that it serves and should serve it well. Black health infrastructure has not been yet built. It needs constant and continual investment, an understanding and a shared vision, support from all aspects of society.
I've gotten support and got to hear from mentors and people who look just like me, who have succeeded in the fields that I also want to pursue in the future. And it has given me hope and confidence to work and do the best of my ability